Glasgow coma scale. Here there are three main elements, that is first one eye opening, second one verbal response, third one motor response. We will say E4, V5, M6. So the first one in eye opening, the response, that's spontaneous eye opening, that score for the sounds. For the sounds, the patient is opens his eyes, the score is 3. To pressure, to while giving pressure, the eye response is 2, and if there is no response, the score is 1. So for the eye opening, we are giving 4 scores, that is spontaneous 4, to sound 3, to pressure 2. If there is no response, the score is 1. Next one, verbal response. Here there are 5 response from the patient, that is if the patient is conscious oriented, the score is 5. If the patient is confused, the score is 4. If the patient is simply spells some words, then the score is 3. The patient is not able to speak any words. Instead of that, he is simply making some sounds or noises, that is the score is 2. And if there is no response, the score is 1. So the verbal response, the total score is 5, oriented 5, confused 4, words 3, sounds 2, and if there is no response, the score is 1. Then next one is motor response. Motor response, if the patient is obeys command, the score is 6, and if the patient is localizing pain, the score is 5, and if the patient is withdrawal, the score is 4, and if the patient have abnormal flexion like a decorticated posture, the score is 3, and if there is extension or a decerebrated posture, the score is 2, and if there is no response, the score is 1. So the motor response, the total score 6. The obese, if the patient is obese command, it is 6. If localized pain, 5. If the patient is withdrawn, that is 4. Abnormal flexion, that is 3. If there is extension, that is 2. Then if there is no response, 1. So the Glasgow coma scale scoring, that is mild, moderate and severe. So if the patient have the mild problems or mild head problems, there will be, the score will be 13 into 15, and if there is moderate score, that is 9 to 12, and if the patient is severe case, that is 3 to 8, and the 3 is the last score, and if the patient score is 3, the patient will be in coma, and the final score is 15. The total score is 15. If the patient has 15, that means the patient is alert and conscious. Thank you.